Important news for men battling prostate cancer. There's a new way to detect it early. CBS 2's Dr. Max Gomez explains.
Ernesto Shore had been following his doctor's orders and getting regular PSA blood tests to check for prostate cancer. When his numbers went up earlier this year, the news was not good.
We found an advanced case of prostate cancer, which good chance it has spread beyond my prostate.
Ernesto had surgery to remove his prostate, and his PSA number then should have been at or very close to 0. Instead, it was going up. Ernesto's prostate cancer had spread or recurred, but where?
So we can do an MRI, we can do a bone scan, but until that tumor gets big enough that we can actually see it, we don't know where it is.
That's where a new kind of PET scan comes in. It uses a radioactive tracer called C11 that is taken up by prostate cancer cells. Dr. David Panis showed me what this PET scan looks like. Lots of normal hot spots, but a closer look shows a hot spot in a lymph node.
We can detect disease before a bone scan becomes abnormal and before a CT scan shows enlarged lymph nodes, thereby able to treat patients earlier if indeed their tumor has come back.
And by finding very early cancer recurrence, doctors can decide the best treatment to deal with the disease.
If it's in a local area, we can do radiation. We can sometimes even do surgery. Whereas if it's more distant, it's like in the bone, we know those modalities won't work, and we go right to hormonal ablation.
Ernesto is thankful that his recurrence was found early.
And of course, if you wait, boom, the cancer really grows, and it could become pretty dangerous.
Now, the C11 test is too expensive and complicated to use as a screening test, and because the C11 degrades very quickly, a hospital like Hackensack has to have a cyclotron on site to make it. But for men who've had prostate cancer and are at high risk for recurrence, the test could be a lifesaver because they find it real early.
Which is everything.
Exactly.
Thank you, Doctor.